Good evening, everybody. When Verity asked me to do some lectures a few months ago, it was just as the pandemic was starting, and we thought that this would be an ideal opportunity to explore my area of expertise, which is economics, specifically looking at this global pandemic that we are facing at the moment. I understand that this is a sensitive and emotional topic area, and what I want to do is lay out as clearly as I can the facts and the effects that the pandemic will have for all of us. It's my intention to have a 30-minute lecture here and then followed by a 20-minute question and answer session. So hopefully you should still be able to enjoy the rest of this glorious evening here in the Midlands. So, by way of introduction, the COVID pandemic has exposed the weaknesses of a complex, interrelated global economy, where the key things are that national interests, which are often paramount, conflict with wider priorities. And I've just taken two there: healthcare and environment. One of the key themes of any pandemic, this and any other in history, is the uncertainty that arises. And in this particular case, it's the uncertainty that's arisen from an interdependent economic system where typically competitive markets are used to produce private goods that are consumed by individuals. And that's undermined in this instance by the simultaneous need for public goods, in this case, public health. So the global economic system is designed to produce services like Facebook and cars and other goods. But the problem we have with a global pandemic is that it is part of what's called a public good. In other words, one that is consumed by everybody. At this point, I'd like you all to think about what the three main areas of impact is likely to be on the economy. Just take a moment and think about that. What do you think the pandemic has affected in the UK economy, the global economy, or indeed your local economy? I did that thought exercise, and the three areas that I came up with are listed there. The first is that the COVID-19 outbreak is the first major global pandemic in a century. The other unusual aspect about it is that there are supply side shocks and demand side shocks simultaneously, and we'll look at those in more detail later. And the final thing is that Nobel Prize winning economists have started to realize is that the policy response has resulted in what is being called the first ever voluntary recession in economic history. In other words, rather than going into a recession because of a financial crisis or a global conflict, economies have voluntarily decided to enter into that recession in order to save their healthcare system or to save lives, or in many cases, both. So whatever you think of the pandemic and its effects on the local economy, the national economy, or the global economy, any economist will tell you those are the three major strands, and we'll explore those throughout this evening's lecture. So, by way of outline, I want to do the following. I want to provide a brief economic history of pandemics, because they are surprisingly common in the grand sweep of history. Secondly, I want to look at the economics of COVID more specifically and drill down into some economic theory. I may be smuggling economic theory in, by the way, so if you see me doing that, you'll know what I'm doing. Thirdly, I want to look at the economic analysis of the recovery. There will be a recovery. The question is when and how long that recovery will be sustained in the immediate term. And then finally, I want to finish off with a question and answer session. One of the modules that I teach at the University of Wolverhampton is a history of economic thought. And actually, the economic history of pandemics, starting from Adam Smith and his Wealth of Nations in 1776, actually goes on throughout history. Pandemics are a surprisingly regular occurrence in economies. Here are just some of them. So 500 AD, there was a Justinian plague. It's one of the earliest recorded, spread from Egypt and North Africa, across the Byzantine Empire into Europe. It's a prototype bubonic plague, estimated to have killed 25 to 26% of the population. The one that you may have heard of after that was the Black Death. This was a pneumonic form of a bubonic plague and is one of the most devastating pandemics in human history. It's possible that it killed up to 60% of Europe. The economic effect of that, of course, is that labour became extremely scarce. So rather than being part of a tied system to your local community, labourers, particularly skilled ones, masons and thatchers and people of those ilk, became very scarce, and they had scarce skill premiums, so they were paid more. It was quite an affluent time to be a apprenticed or tradesman. Then more recently, the Great Plague, that killed up to 20% of the population in the medieval periods. And then there are episodic outbreaks of things like cholera in Russia. Note the dates, 1815, 1853. They're just after the Napoleonic Wars and the Crimean Wars, respectively. And they were brought back across from these conflict sites through the British Empire. Then, of course, the one that I mentioned in passing in the introduction, the so-called Spanish flu of 1918, 1920. It probably started in the trenches in 1916, but of course, the combatants were dying of other reasons, and therefore the precise pandemic element was not picked up until after the Second World War, when people were dying in even greater numbers than the combatant deaths. So as you can see, grand sweep of history over 1,000, 1,500 years, there are waves of pandemics that affect both peacetime and wartime and have an influence on things like the labour market, scarce skills, and so on and so forth. You might think then that with tremendous advances in medical science, medical imaging, antibiotics, other forms of cures and help, that such things would be a thing of the past. What we're faced with here, look at these 7 episodes, including and up to COVID-19. These are events of the last 20 years. SARS, H5N1, H1N1, MERS, Middle Eastern Respiratory Syndrome, Ebola, Zika. These are epidemics that could have become pandemics, but didn't, either through good luck or good judgment. What an economist would say here is that there is possibly an example of what's known as time inconsistency. In other words, rather than taking these episodic events of epidemics as an early warning, they were not fully taken on board. They were not ignored. Epidemiologists would have studied them in great detail, but the economic system didn't adjust to take into account the public health requirements. In other words, there weren't greater investments in things like track and testing, except for some countries like Korea after SARS. There wasn't great investment into public health and public policies. In other words, these early warnings were missed, and therefore what policymakers did is suffer a time inconsistency. In other words, they overvalued the benefits of not investing and undervalued the costs. Hence, we weren't as prepared as we could have been, given those early warnings. The other element of economics here relates to the incredible work of a philosopher called Nicholas Nassim Taleb, who talked about the black swan event. Now, a black swan event has three characteristics. It has a very high impact, it is very rare, and is unpredictable. The classic example here that's often given is 9/11 in 2001, with the World Trade Centers were attacked. Luke Kemp at the University of Cambridge has said that what we're experiencing here, to coin a phrase, is a black elephant, because COVID does have a high impact. It is very rare, but it was predictable, as we saw both over great waves of time or in the immediate past. In other words, the elephant in the room was ignored, hence the phrase black elephant. The other thing that I want to put into frame here is something that I mentioned in the introduction, and this is supply side and demand side. Anybody that's done any economics will have realized that a market is composed at its broadest sense into a demand side and into a supply side, and the interaction of those supply and demand schedules gives us an equilibrium, and that forms the market. In economics, there are systemic problems. Those systemic problems can either experience an internal shock or an external shock. The internal shock is known as an endogenous shock. It's from within. The exogenous shock is from outside. So typically, the type of shock affects the demand side or the supply side, and the genesis, the origin of that, is either endogenous or exogenous, from within or from outside. So the financial crisis of 2007-8 was an endogenous shock on the demand side. The oil price shock of 1973, 1974, that was an endogenous shock on the supply side. 9/11 was an exogenous shock from outside. It affected the demand side, and a natural disaster like a tsunami is a supply side exogenous shock. What's special about COVID-19 is that it is both an exogenous shock on the demand side and the supply side. And that is why we're experiencing such profound economic consequences. So that is by way of an overview of an economic history of pandemics. And as I said, I smuggled a bit of theory in there for you. What I want to go on to now is to look specifically at an economic analysis of the COVID-19 pandemic. The study of economics and pandemics falls under the heading of health economics. Usually you would have come across this with things like the National Institute of Clinical Health and Excellence, where they were commissioning drugs from pharmaceutical suppliers. And they would typically do things like work out the cost-benefit analysis of a procedure or pharmaceutical drug, or look at QALYs, the outcome of life, the quality of life from that intervention. So these are non-trivial things, and they've affected the way we view the economy, because in a public national health service as we have in the UK, or even an insurance-based healthcare system elsewhere in the world, health matters. Health is important, and therefore with scarce resources we still need to decide who gets what when. Why this event is so damaging is a supply side and a demand side shock, as we investigated previously, but also it affects the three main areas of economics: macroeconomics, gross domestic product, the measure of output and business cycles; mesoeconomics, the way that systems operate, either international trade or balance of payments; and at a microeconomic, the market level and prices. We're going to explore all of these, specifically GDP. I want to take us back 6 months in time and look at the UK economy in 2019. Seems a long time ago now, but 6 or 7 months ago, at the end of 2019, with the election of the Conservative government with a majority of 80 and Prime Minister Boris Johnson and his government, the UK was still in a state of flux after the 2016 EU referendum had resulted in Brexit. If we look then what the economy was experiencing, we had comparatively slow GDP, which is gross domestic product. This is the way economists measure the productive output of any economy. Growth was between 0.2% and 0.3%. To put that into perspective, the long-term average is somewhere between 1.5 and 2%. So we were underperforming at that point. CPI, the Consumer Price Index, inflation was about 1.4%, and the labour force participation, unemployment, was about 3.5. So those are our baseline statistics. As we move into what statisticians call a structural break, what we could also call the brick wall of COVID. So this was the Bank of England projections at the end of 2019. The thick black line that you can see on the top left-hand panel, that's the Office for National Statistics data. And that is showing over the last 4 or 5 years the variable nature of the UK economy in terms of GDP. So what we notice about GDP in general is that economies grow over time, but typically in a non-linear way. It goes up into a boom and goes down into a bust. In other words, there are periods of recovery when the economy gets better, and there are periods of recession when the economy gets worse. So as you can see, the economy was at about 2% in 2015. Brexit happens, and then there is a slow decline. In the middle of 2017, for example, it was getting very close to 1%, becoming variable again. These predictions are on various assumptions that the ONS the Bank of England rather was working on the ONS data, but effectively it has a fanned effect. We're not expecting the economy at the end of 2019 to be -1 or +3, but those were the various bands given the assumptions that they were making. It was most likely to be the darker green line that you can see in the middle. But as we've shown there, that dotted line is the structural break. In other words, COVID-19 happens and all bets are off. We then enter this situation we were talking about earlier, about the interaction of health and wealth. And what's interesting here is that economic studies have found that productive and wealthy economies tend to have healthy populations. So we're talking here about a medical economic trade-off, but it's not quite as simple as that. Healthy populations make for a wealthy economy, and wealthy citizens in that population tend to be healthier. So it's a virtuous circle. However, if we look at this situation here on the graph, we've got a mirror image. So the horizontal axis, it represents time. The vertical y-axis from the intersection of the horizontal axis, above the line gives us new cases of COVID, below the line gives us GDP loss. If the economy was not to intervene and shut down, the red line would have happened. In other words, we'd have had a lot of COVID deaths, but the economy wouldn't have been affected as much. Because of the intervention, stay at home, be alert, etc., etc., the blue line materialized. In other words, the new cases didn't jump, but the containment policies pushed the economy into recession. So in general, health and wealth go hand in hand in any economy, in any economic system. But in this particular situation, they conspired against each other to keep people healthy and not to have a strain on the health service. The economy was closed down to a certain extent, and that led to recession and some of the problems that we're going to face for the next months, years, and possibly decades to come. So what is the current state of the UK economy then, having gone through the last 4 or 5 months of COVID plus the 2 or 3 months of leading up? This is the latest data from the Office for National Statistics as published by the Treasury, Her Majesty's Treasury. It's a recession, which we expected, the first time in 11 years since the financial crisis of 2007-8. The UK economy contracted by 20.4% in Q2. The unemployment crisis, though, because of the furlough scheme, is on hold. Unemployment is starting to rise, but it's not the avalanche or the massive decline that the UK economy more generally has had. In other words, we're in this holding scheme. It's Q3 and Q4 is going to be crucial. The other thing that we note is that inflation is starting to rise above 1%. In this case, that's a good thing because it means that there's economic activity going on. But here's the crucial thing. The base rate from the Bank of England is at 0.1%. That's the lowest that the bank base rate has been since the Bank of England was nationalised or effectively came into being in 1694. This is unprecedented. because since March 2009, we've had interest rates at 0.25%, a quarter of 1 percentage point, there or thereabouts, bouncing between 0.5 and 0.25. There's nowhere for interest rates to go. Let's look elsewhere. Let's look at what the effects have been on the Chinese economy, for example. Here, the red line represents 2020 in China. The line above that was what they were doing in 2019. Now, interestingly, during the Chinese New Year celebrations, China effectively locks down, but only for a brief period of their festivities. So as you can see at the point where it says the Wuhan shutdown begins, that's right across Chinese New Year in late January. And so they ski slope down to a huge contraction of their economy that has slowly but inexorably started to increase back up. And compare that with the shaded area above, which is the performance that China did in a non-COVID year, i.e. the last year of available data, 2019. So you can see that the shadow of COVID on an economy like China, the second largest economy in the world, is profound. So we've looked at the history, we've looked at the economics. Let's look at the recovery. There will be a recovery. It's just a question of when and how long it will be sustained in the immediate term. Economists try to model the economy in a series of interrelated sectors. Basically, it's firms in the red box there and households in the blue box. What we're seeing here is that the biosphere and the economic system is interreacting. In other words, the golden thread, as represented by the COVID effects, has severed links between firms and households in the labour market. It has severed links between firms and households in the goods market. It's actually reduced pollution and waste. We're not driving as much, we're not travelling as much, and so pollution is down. But it's had a whole mashup of other effects on the economy. These are the effects in the UK recovery phase. So if you look at this is the UK economy over the last 18 months or so. The horizontal line at 0%, that is monthly GDP growth, gross domestic product growth. In other words, how much the economy grows. You can't see much because the negative red panels are quite small and the positive blue panels are quite small because we've basically been flatlining as the uncertainty of Brexit and US-China trade talks affect the global economy too. Then we hit this structural break and we've got this massive decline, and that's basically Q2, and Q3 is the blue line where we're starting to unlock. The 4th of July was Independence Day, the pubs opened, the cafes started to trade again, and so on and so forth. I want to talk a little bit here about what I've called Sesame Street economics. Growing up in the 1970s, one of the two great delights of television that I did with my mother and father, one was Laurel and Hardy, and the other was Sesame Street. And Sesame Street always brought a letter. The end of each episode, a letter would be brought to the children. And there have been economic studies to suggest that the US areas that had greater cable access to Sesame Street have shown the greatest increases in educational attainment amongst lower income groups. Anyway, that's by the by. Today's lesson is brought to you by 4 letters: the letter L, the letter U, the letter V, and the letter W. If we have a recovery of a letter L, it means the economy is going to be flatlining and unresponsive to policy. This is a dangerous situation to be in. Letter U is the usual upswing, as I said, between boom and bust. Letter V is the rapid and profound improvement. The letter W is a double dip following a faltering economy. If we go back a slide, we can see we've had this sharp contraction, the blue columns there in quarter 3. The growth has started to come back in the reduction in quarter 2 is the red lines, and the increase in quarter 3 is the blue lines. It's not sure yet whether that is part of a rapid and profound improvement V, which the government is desperately hoping for, or the first formation of a W and a double dip. So it's still too early to say whether the government's hope for rapid and profound improvement, a V-shaped recovery, is happening, or it's the first part of a double dip. If the UK contracted by 20 to 22%, how did it compare internationally? These are figures from the Office for National Statistics compared to OECD countries, Organisation for Economic Cooperation and Development. From this selected group, only Spain did worse. France, Italy, Germany did better, and as did the US. So there are some lessons here for the UK to learn. Want to end on a relatively positive note, because we've all suffered to a large or lesser extent. We all know loved ones and neighbours who may have passed away, or we know people that might be in danger of losing their job if they haven't done so already, or affected in other regards. I think this is an ideal opportunity. We've had this structural break, but we could actually be in a situation where we can reset the economy. We might want to start greening the economy, using less fossil fuels and thinking about the ozone layer and tidal levels. We might want to start thinking about localism and bringing more community into our spatial areas. We might want to engage in more equality, redistribution. Remember, a healthy workforce and population is a wealthy one. And we might also want to come across the time inconsistencies and start future-proofing the economy by making provisions for future pandemics so that we're ready in a public health and in an economic perspective. Thank you.